One of the main causes of poor air quality in Lower Mainland and Fraser Valley is wildfire smoke. Wildfire smoke contains fine particulate matter, also known as PM 2.5, which are tiny particles that can enter deep into the lungs and cause health problems. According to Environment and Climate Change Canada, wildfire smoke can trigger an air quality advisory, which means that the air quality is unhealthy for some people, especially those with respiratory or cardiovascular conditions, older adults, children, and pregnant women. Another cause of poor air quality in Lower Mainland and Fraser Valley is local sources of pollution, such as vehicle emissions, industrial activities, wood burning, and agricultural burning. These sources can also contribute to PM 2.5 levels, as well as other pollutants such as nitrogen dioxide, ozone, and sulfur dioxide. These pollutants can affect the eyes, nose, throat, and lungs, and can worsen existing health conditions such as asthma, chronic obstructive pulmonary disease, COPD, and heart disease. Poor air quality can have short-term and long-term effects on your health. Short-term effects include irritation of the eyes, nose, and throat, coughing, wheezing, shortness of breath, chest tightness, and headaches. Long-term effects include increased risk of lung cancer, chronic respiratory diseases, cardiovascular diseases, and premature death. To protect yourself from poor air quality in Lower Mainland and Fraser Valley, you can take some simple steps such as checking the Air Quality Health Index, AQHI, regularly to know the current and forecasted air quality conditions in your area. The AQHI is a scale from 1 to 10 plus that indicates how air quality affects your health. The higher the number, the greater the health risk. Avoiding or reducing outdoor physical activity when the AQHI is high, 7 or above, especially if you belong to a sensitive group or have symptoms of poor air quality exposure. Closing windows and doors to keep indoor air clean and cool. If you have an air conditioner or a portable air cleaner with a HEPA filter, use it to filter out PM 2.5 and other pollutants from the air. Seeking shelter in public places that have clean and cool air, such as libraries, community centers, or shopping malls. Drinking plenty of water to stay hydrated and help your body flush out toxins. Following your doctor's advice if you have a chronic health condition or take medication for breathing or heart problems. Have your rescue medication with you at all times and seek medical attention if your symptoms worsen. In this section, I will share some tips on how to monitor the air quality index and what actions to take depending on the level of risk. The Air Quality Index, or AQI, is a scale that measures how clean or polluted the air is in a given area. The AQI ranges from 1 to 10, with 1 being the best and 10 being the worst. The AQI also has different health risk categories: low, moderate, high and very high. To monitor the AQI in your area, you can use the interactive map provided by the BC Air Quality website. You can zoom in to view individual stations and click on them to see the latest data and information. You can also find air monitoring stations by air zone or through the AZ index on the same website. Alternatively, you can visit the Air Quality Health Index website to view the current and forecast AQI for different regions in BC. Depending on the AQI level and your health status, you may need to take different actions to protect yourself from poor air quality. Here are some general guidelines. If the AQI is 1 to 3, low risk, you can enjoy your usual outdoor activities. This is the ideal air quality for outdoor activities. If the AQI is 4 to 6, moderate risk, you may want to consider reducing or rescheduling strenuous activities outdoors if you are experiencing symptoms such as coughing, throat irritation, headaches or shortness of breath. People with chronic conditions such as asthma, COPD, heart disease or diabetes are more likely to be affected by moderate air pollution. If the AQI is 7 to 10, high risk, you should avoid strenuous activities outdoors. Children and elderly people should also avoid outdoor physical exertion. People with chronic conditions or acute infections such as COVID-19 should stay indoors and keep windows and doors closed. If you have an air conditioner, make sure it has a clean filter and recirculates indoor air. You may also want to use a portable air cleaner to reduce indoor pollution. If the AQI is above 10, very high risk, everyone should avoid outdoor activities and stay indoors as much as possible. Follow the same tips as for high risk, but also avoid smoking, burning candles, using gas stoves or fireplaces, or doing anything that can worsen indoor air quality. It is important to monitor the AQI regularly and follow the health advice accordingly. Poor air quality can have serious impacts on your health and well-being, especially if you are exposed for a long time or have pre-existing conditions. By taking these simple steps, you can protect yourself and your loved ones from poor air quality in Lower Mainland and Fraser Valley.